Hello, welcome back to Political Science 400 500C, Public Policy for Health Security and Resilience. My name is Nathan Myers, and this is a continuation of our discussion about community resilience to kind of bring a conclusion to the course. And I had talked about in an earlier presentation trying to bring together these concepts of community resilience and some of the other topics that we've discussed throughout the course in terms of public health emergency preparedness and response. And I think this article is actually a good framework for doing that, titled Information Sharing and Community Resilience, because it brings together the idea of surveillance with community resilience, but I think also touches upon a number of the other things that we've talked about in terms of capabilities that communities need to have to manage a public health emergency response. So if you look at the abstract, I think the final few sentences really get into the heart of what this is about. It says more community involvement in terms of the collection and dissemination of information can provide value in terms of preparation for a public health emergency by bolstering surveillance efforts to detect a threat early on. So there, if we think back to week 3, talking about epidemiological data, we've talked about the importance of epidemiological data. So people being involved with the collection of that, and in the case of avian influenza, we've talked about, this data is not just about human health, but about animal health as well. So you can have farmers and other people in the agricultural sector, veterinarians involved in that kind of activity. And then it goes on, getting the public more integrated into the public health information system can also be valuable in terms of diminishing the threat of mis and disinformation. So when we get into the concepts of mis and disinformation, then we're thinking about communication. And we talked in the communication section, part of risk communication is disseminating messages that not only provide good information, but also dispel the inaccurate, whether intentionally or otherwise, information that is out there. So presumably if you've got more people in the community involved in this information system, it makes it easier to build trust toward that information and dispel some of the inaccurate information. Building up relationships between the public and the public health sector can advance the mission of improving community resilience through education, engagement, and collaboration. So in terms of education, we obviously had the section on training and exercising to prepare people for public health emergencies. So part of, training and education are obviously similar concepts to each other, giving people the knowledge that they need to be able to respond in these situations and provide services in these situations, and to really get people to invest in the importance of this type of work. And then talking about engagement and collaboration, there again, we get into, the community resilience topics. In a previous recording focused on community resilience, we talked about the importance of engagement and collaboration among different levels of government, as well as between government and the nonprofit sector and government and the for-profit sector. So that's something that's been addressed substantially as well. So there's a lot within this single article that sort of brings together these resilience topics with some of the other topics that we've discussed previously. So I'm not going to go through this in great detail. I'm just going to kind of go section by section and kind of highlight some of this connective tissue. So again, the idea of information sharing and surveillance. So in a recent discussion post, set of discussion posts that I recently finished grading, people did a very good job of talking about how the medical sector, hospitals and health providers like that need to be integrated with the public health sector and the veterinary sector as well, that they need to be sharing information so that there's a full picture of the sort of prevalence of a disease and how severe it is and the degree that it's affecting animals, the degree it's affecting humans. And that obviously plays into that topic of surveillance. We want to have early warning systems in place so that the public health sector and the medical sector can be better prepared to treat people and to provide, vaccinations and other services as necessary. And also, as an early warning system, so if we have to ramp up the purchasing or manufacturing of personal protective equipment, we have the means of sending those signals to the manufacturing industry so that we're not caught without the resources that we need to allow doctors and nurses and other professionals to treat patients and to also provide all the other usual work that they do in the health field. So in terms of information sharing and combating mis and disinformation, part of the idea here is that, and I've mentioned this previously, how, one of the things I heard a lot and discussed with people that I know during COVID-19 was distrust in the numbers, distrust in the statistics. People didn't believe the numbers coming out of public health organizations and hospitals about how many people were infected and how many people died and things like that. And when you don't trust that kind of information, then you're not going to take the risk as seriously. You're not going to be as careful to protect yourselves or even your families in that situation. So, obviously, if avian influenza were to become a bigger threat in the United States or around the world, combating the same type of mis and disinformation would be important. So the more people you have involved in producing information themselves, if within your community, it's, doctors that nurses that people who work in public health departments, veterinarians that even farmers that or farm laborers that if the more the information is being produced by people that you have some kind of relationship with, the more likely the research says you are to trust that information. So when information is seen as just coming from up on high, whether it's coming from the federal government or the state government, it's easier for some people to dismiss as being inaccurate or being produced with some kind of political agenda. And it's true, as we've discussed in a previous presentation, that political fragmentation, political divisions are becoming more severe, even within individual communities. So, I certainly don't discount the possibility that people are going to distrust doctors and veterinarians within their own communities. We did see that during COVID-19, certainly, where people were being dismissed. But I think by and large, in a previous presentation, we talked a lot about democratizing deliberations and things like that. And what this is talking about is sort of democratizing the production of information and the use of surveillance. So it's not just these public health officials, these sort of amorphous authority figures doing it, but it's normal, average citizens helping to monitor for these risks. And take, if these types of people are seen as taking these risks seriously, maybe more people in the community will take these risks seriously and not just discount them as, the government trying to force vaccines on people or something like that. So in terms of information sharing and resilience, it's sort of a bi-directional relationship in the sense that at its most basic level, relationships between organizations involves information sharing. That in some ways is kind of the fundamental or foundational level of interaction between different types of organizations, whether they're different levels of government, whether they're the government in the nonprofit sector or government business or civic organizations, sharing information amongst themselves sort of forms the basis for relationships that can then go on to be productive in other ways, sharing other types of resources, actually coordinating on different projects. So information sharing oftentimes leads to higher levels of resilience, higher levels of collaboration and coordination and so forth. And then that ultimately produces greater community resilience. But then community resilience in turn then produces better, higher quality information. We've talked about, syndromic surveillance, for example. Syndromic surveillance depends a lot on integrated networks between pharmacies, hospitals, the public health sector. So for something like a syndromic surveillance system to be effective, you've got to have this network established. And if you have that network established, presumably you've got a higher level of resilience in your community because you have more of these governmental institutions and non-governmental institutions working together and thereby producing the best picture possible of how severe a risk is in the community and how severe it is, how widespread it is. So this idea of the nexus between surveillance, misinformation, and disinformation and community resilience. So, mis and disinformation in a lot of ways is the enemy of community resilience. Because if you've got, on the extremes, you have one hand, people who believe that avian influenza is an existential threat to the community. And on the other hand, you have people who believe that avian influenza doesn't really pose any risk to the community. The more polarized the community is, the harder it's going to be to get people to agree on courses of action and to agree on policy. And mis and disinformation really does serve to polarize people on both sides of the argument. So the argument that this commentary article basically makes is that surveillance is important, but in order to combat the mis and disinformation and thereby promote greater resilience, the surveillance has to incorporate a variety of actors, and the public has to have some level of investment and some level of involvement in that surveillance and in the production of that information. Because then if people have more investment and more involvement in the production of that information, they'll be willing to go further in terms of arguing that it is accurate, that this is something that's going on. This is something that should be taken seriously, and combating that mis and disinformation. And thereby, presumably there'll be a greater level of community resilience in the end, because if people are more willing to trust people within their own communities, which again, a lot of research suggests that people are more willing to trust people in their own communities and their friends and their neighbors than they are people on television and people in government, then people will be less quick to embrace internet rumors and more likely to embrace the information that their neighbor is saying, no, I saw this firsthand on so and so's farm, or I've seen this, in the hospital, I've seen this firsthand. And again, this is not to say that there's not still going to be some segment of the population that will continue to discount this. Here in Vigo County, we saw hospitals setting up tents outside to take in COVID-19 patients. And in Indiana, the National Guard was coming in to help in nursing homes and places like that. And people were still saying that COVID-19 wasn't much of a threat or much of a risk. So there's always going to be some segment that is going to be persuaded by the mis and disinformation. But the idea is, to bring as many people into the fold in terms of coordination and collaboration, and working to create a picture of what's going on so that the community can respond. And part of that response is the communication aspect. Communication with their friends, neighbors, family members. So in terms of wrapping up the discussion. So this is, looking back at the COVID-19 pandemic. So this last paragraph, the COVID-19 pandemic has sharply illustrated the difficulties involved with trying to control a threat as data is being questioned. So there again, we go back to what we talked about in week 3 with the importance of data and how it can be put into controversy by internet rumors. Inaccurate information is being disseminated and communities are not united in common goals, therefore eroding community resilience. So Gonowitz et al. Conclude that moving forward, a fail-safe information system that is independent of socio-political relations to avoid misinformation and confusion will be necessary. And presumably, this kind of information system that is not seen as politicized will need to involve a high level of community buy-in, a high level of public buy-in. So as we continue to fight our way through the current emergency, as this was written while COVID was going on, while looking ahead to the next, which could be avian influenza, we must continue to pursue ways to make all community members invested in the response. If more citizens are engaged from the very beginning by helping to detect the threat through surveillance, they'll be more invested in sounding the alarm. There again, the risk communication piece and overcoming the voices of mis and disinformation, also part of the communication piece. Furthermore, both preparing for such events, so again, getting into the training, exercising aspect, and then working together in the aftermath. Community resilience builds on Chandra et al.'s levers of community resilience, particularly education, engagement, and partnership. It's important moving forward to transition community members from being passive consumers of information in regard to health threats to producers and defenders of this vital resource. So again, going back to some of our previous community resilience readings and talking about democratizing processes and making people more partners in preparedness and response, and not just people to whom the government is communicating and saying, you must do this, you must do that, or this is what's going on, but bringing the community members more and more into a partnership with government, with the nonprofit sector, with businesses to deal with the challenges that could be coming. So again, the idea, and I encourage you to read the full article, obviously, but I wanted to kind of focus on this as a way to bring everything together, to think about how community resilience relates to data, the use of data in pandemic preparedness and response, how it relates to risk communication, staffing, training, exercising. Obviously, when you get into topics like vaccination and things that can be more controversial. Vaccines was obviously another area where there was a lot of dis and misinformation. So again, one of the things that was found in research dealing with vaccine skepticism is, arguing with people online and telling people why they're wrong hasn't really been found to be all that effective of a strategy. It's been found to be more effective when people hear friends that they know were vaccinated or had their kids vaccinated and everything was fine, nothing bad happened. That tends to be more persuasive than going and arguing sort of the scientific facts behind vaccination. Because it's been found that when you argue with people, people just become more dug into their pre-existing position and they really don't shift from their position. So rather than arguing, providing sort of a model or a frame of reference for the other side is seen as a better approach. So I just kind of want to leave you with this idea and emphasize the idea that all of the topics that we've touched upon in terms of avian influenza and the relationship between doctors and veterinarians, the importance of epidemiological data, the importance of the supply chain, keeping the supply chain functional, risk communication, training and exercising, vaccination and taking other steps to control potential pandemics. All of this is related to these ideas of community resilience that we talked about at the beginning of class and we returned to at the end. So this is all very much interconnected. And the key takeaway, obviously, is, again, the public cannot be passive. The public cannot just be expected to be obedient to whatever the government says. The public has to recognize that they have an important role to play, not just in following instructions, but in providing data and providing channels of communication and helping to sort of prepare for these emergencies. And then when these emergencies do occur, making sure that the response is one that as many people in the community can embrace as possible. So with that, I'll go ahead and conclude this presentation. Thanks very much for your time and attention. I hope you found the class to be worthwhile and you've learned some things of interest and some things you can use in your own lives. And if anyone has any questions, I'll be more than happy to address them. Thanks very much.